Are these panels accurate on diabetics?
Oh, great question. Really great question. So people with diabetes, obviously, right out of the gate, have a high risk. And to the extent that we now have not one, but two classes of anti-diabetic therapies that can actually reduce cardiovascular events, this brings it even into sharper focus, you know. So the American Diabetes Association is in fact in the process of evaluating their position on whether we should be screening our patients with diabetes utilizing some of the biomarkers that we have in our panels, natriuretic peptides and troponins in particular. And the reason why is patients with diabetes, even in the absence of manifest cardiovascular disease, frequently have underlying heart disease. It's well recognized. Diabetes is essentially an equivalent for the presence of cardiovascular disease. So we looked at this question utilizing these tests, and the answer is there's a remarkably powerful ability, in particular of the CVE assay, the cardiovascular events assay, for actually not only predicting adverse outcome in diabetes, but the risk is like 4 or 5 times higher if your CVE is elevated in a person with diabetes. So the answer in long form, I can shorten to absolutely yes. These tests work remarkably well in patients with diabetes, a population, quite honestly, that we should be focusing all efforts on with drugs like SGLT2 inhibitors and GLP-1 receptor agonists.